What can I do, Ryan? Please stop eating. The deadline of the thesis is approaching.
The deadline is rigid, but we are not. I'm sure we'll come up with an idea, but I can only help you when I'm full. I know I'm handsome, but you don't have to look at me with a steady gaze. It's no use putting pressure on me. I've been thinking of the thesis topic for you all along. Hey, Fong.
Oh, hi. It's good to see you.
Wow, 1 bag, 2 bags. They're all so heavy. Your job is really hard.
Ah, yes. I walk a lot and my feet are so painful.
Hey, how's your girlfriend Maggie? I've not seen her for ages.
We broke up already.
How come?
She said I was unwilling to accompany her all the time. Actually, my feet are so painful after work every day that I don't feel like walking anymore.
Wow, it's so serious.
At the moment, I often wake up and step out of bed, and it's so painful that I even have a burning sensation, redness and swelling in my feet. I really don't want to go to work.
It's so serious? Have you seen a doctor?
Still have to earn my living. I'm in a hurry. Bye now.
By the way, you already know that my sister is a teacher. She has told me that her calf is so painful and has swollen veins. Later, a doctor said she is suffering from lower limb varicose veins.
You were right. Seeing Fung carry such heavy objects to walk around, I preliminarily supposed that he contracted plantar fasciitis.
We need to help him, otherwise he not only lost his girlfriend, but will lose his health as well.
You change your mind so quickly. Have you decided to help others and forgotten about your thesis already?
Of course not. I've decided my topic already. The disease that Fung and my sister contracted can be concluded as lower limbs musculoskeletal disorders, which is a work-related disease. Let's use lower limbs musculoskeletal disorders as the topic of my thesis.
That's great. We need to start searching for information then.
You must help me out.
Okay, let's go.
Ryan, have you ever noticed that, like many other salesmen, May needs to stand at work very often?
Yeah. She needs to stand for more than 10 hours a day. The pressure that the foot needs to bear is tremendous.
Yeah, that's right. And I also noticed that salesmen who wear low-heel shoes to work are more relaxed at work and have more smiles. May, who wears high-heel shoes, seems to be uneasy and seldom smiles.
I agree. Wearing high-heeled shoes for a prolonged period will strain the feet. This is one of the causes for plantar fasciitis.
I see.
Maybe May wears inappropriate shoes for a prolonged period causing foot pain, and that's why she seldom smiles.
That should be true.
You see? May seldom smiles, and so does Auntie Chow.
Yes, could it be that Auntie Chow is worrying about her family matters recently?
Or you, the boss's daughter, get used to treat people badly so that colleagues do not feel happy at work.
No, that's not true. Auntie Chow? Oh, here you are. Come in and have a seat. Why are you here at the kitchen? Auntie Chow, are you fed up with the heavy workload, or is there anything wrong with your family recently? Not really. Why do you ask this question? Then why do you look unhappy and uneasy? If you really feel unhappy, you need to tell me. I know you're a good girl. Maybe I am getting old. My knee does not function well. I feel so painful when I squat and stand up. Sometimes I feel that my knee is a bit stiff and I cannot move freely. Okay. Go out quickly. It's so wet here.
I guess that Auntie Chow is likely to develop osteoarthritis of knee.
I suppose the same. I just realized that prolonged standing at work is so unhealthy.
Yeah. Oh, take a look at Chef Ho.
Chef Ho seems to suffer from lower limbs musculoskeletal disorders as well, as he has to stand a lot at work, which strained his feet.
You have so many friends with lower limbs problems. It's time for you, a physiotherapist student, to think of some solutions to help them solve their problems.
All right, I will do my best to finish this thesis. I must be able to find solutions for them. But, Ryan, where can I find the solutions?
As your senior, I know that for certain. There are information and publications on prevention of lower limbs musculoskeletal disorders available at the offices of the Occupational Safety and Health Council and the Labour Department or on their websites.
Hi, everybody. The reason why Ryan and I asked you all to come today is to let you know that I have finished my thesis.
What? Me too? It's nothing to do with me.
Of course it does. Chef Ho, tell me, do you have foot pain?
Yes, I have.
Do you have foot pain? Yes, I have. Do you have foot pain?
I have it.
I also have. So, there is something to do with all of you. We find that workers in the catering industry, the retail industry, and other industries which require prolonged walking and standing are suffering from severe lower limbs musculoskeletal disorders, like all of you and my sister. Your sister can move around freely. She does not seem to have any problem. I used to have lower limbs musculoskeletal disorders before. You all know that I teach in primary school. I need to stand while teaching. I even need to go to the playground to keep an eye on students during recess. So there's only very limited time for me to sit down and take a risk. The pressure imposed on both my feet is increasing over time. I did not want to move because of foot pain. After consulting a doctor, the doctor said I contracted lower limb varicose veins. Yeah, you are so right. Do you know why my sister can move around freely now? It is me, a would-be physiotherapist, who helped her to get rid of the disease completely. From the observation and studies Ryan and I have carried out recently, we find that lower limbs musculoskeletal disorders, which is a work-related disease, is now doing harm to your bodies and affecting your daily lives.
Auntie Chow should be suffering from osteoarthritis of the knee.
What can I do then?
Don't panic. Osteoarthritis of the knee is a common type of degenerative arthritis resulting from damage of the articular cartilage and disruption of the underlying bone structure of the knee joint, leading to pain and disability. The main causes of this disease are degenerative changes of the knee associated with aging, knee trauma, excessive stress to the knee due to overweight, additional load borne by the knee in lifting and carrying heavy objects, frequent and repeated bending of the knee, and other factors like congenital diseases of the knee. The symptoms of the early stage include joint pain, especially when walking up or down stairs, and stiffness of the joint, particularly after periods of inactivity, like when waking up in the morning. At the late stage, joint pain and stiffness increase. In more severe cases, there can even be tenderness and swelling of the joint.
Oh no, I've got most of the symptoms.
Is there any preventive treatment for this disease?
Yes, of course. The preventive measures are avoiding prolonged walking, avoiding prolonged bending of knees or squatting, reducing manual handling operations or using suitable mechanical aids like trolley to decrease the stress on the knee, maintaining appropriate body weight, and performing suitable lower limb exercises to relieve fatigue and strengthen the muscle.
When you feel pain at your knee, the preliminary treatment is to use a hot water bag to do heat application. This can relieve the pain. As for Mei and Fung, you certainly belong to the high-risk group of lower limbs musculoskeletal disorders, as you need to stand or walk for more than 10 hours a day. It is very likely that you two are suffering plantar fasciitis already. Plantar fasciitis presents as inflammation of plantar fascia as the soft tissues around it due to injury or strain. That is why you always feel pain at your feet. You may even find redness and swelling at your heels.
That is correct. Apart from prolonged standing or walking which strains the feet, the causes of plantar fasciitis include personal factors like overweight, flat foot, club foot, and so on. Wearing inappropriate shoes for a long period of time, for example, body too tight, sole too hard, or heel too high, and so on. And carrying heavy objects frequently, thus increasing the stress on the foot. The symptom of plantar fasciitis is heel pain, which is particularly significant when stepping out of bed in the morning and worsens after prolonged standing or walking.
Yeah.
Oh really? What can be done then?
Well, to prevent plantar fasciitis, first rest the foot. Avoid prolonged standing or walking. Sit and rest or perform some foot exercises after standing or walking for a period of time. Try to reduce the pressure on the feet. For example, avoid carrying heavy objects or use trolleys when needed. Besides, selecting suitable shoes is also very important. Choose comfortable and lightweight shoes. Shoes having softer soles have better shock absorption ability to decrease shock arising from walking. Use appropriate insoles to reduce pressure on the foot if necessary. And avoid wearing high heel shoes for a prolonged period of time. Place a fatigue prevention mat at the standing locations to distribute the pressure evenly over the sole and to help decrease the stress on the feet so as to relieve muscle fatigue. If unfortunately you are suffering from it, the preliminary treatment can be taking rest. Suitable rest can reduce stress on the feet and pressure over the sole. Or ice therapy. Wrap ice cubes in a towel and apply it over the sore part for 5 to 10 minutes can relieve pain and swelling. If things get worse, doctors would suggest medication or local injection of analgesics to help relieve pain and control inflammation. Physiotherapy will also be used to alleviate the symptoms of inflammation and strengthen muscles and tendons.
Actually, apart from salesmen, many occupations may suffer from the lower limbs musculoskeletal disorders like teachers, postmen, nurses, couriers, and cooks.
What? Me as well? I only feel a little pain after standing for a long time.
Chef Ho, apart from tiredness, is there any feeling of itchiness at your leg and swelling of the veins at the calf? If yes, then it's very likely you are suffering from lower limb varicose veins. Lower limb varicose vein presents as dilated, tortuous and swollen veins over the lower limbs. It is mainly due to defective function of the valves of the veins or intrinsic weakness of the venous wall. The symptoms are dilated veins over the lower limbs without any symptom initially, skin itchiness of the affected area, heavy sensation and dull ache of the affected leg, ankle swelling after prolonged standing. If things get worse, complications such as eczema, bleeding and ulceration in the affected area may occur.
This is quite true. Oh no, what can I do?
You don't have to worry too much.
Yes, it is very simple to prevent. First of all, avoid standing or sitting for a prolonged period of time. Sit for a while or perform some lower limbs exercises after prolonged standing. Move around after prolonged sitting to enhance venous blood return from the lower limbs. Besides, reduce the pressure in the lower limbs. Maintain appropriate body weight. If work requires prolonged standing, shift your weight from one leg to the other from time to time to rest your legs alternatively on a stool. For those who have signs and symptoms like Chef Ho, there are treatment of different degrees. For example, taking rest. Dull ache and swelling of the lower limbs can be relieved with periodic resting and leg elevation. Or using compression treatment. Wearing elastic stocking or applying elastic bandage to the affected lower limb can increase its venous blood return.
If things get worse, you must see a doctor. Doctors may inject sclerosant to obliterate the dilated veins. The last possible therapy is surgery.
Oh no, it's better to prevent it as soon as possible.
Yeah, of course, it is best to prevent as soon as possible. So apart from paying attention to the said preventative measures, doing the following stretching exercises regularly may also help. I am now going to teach you how to do it. Well, first, calf muscle stretching exercise. Stand with feet apart at shoulder width. Left foot step forward. Place your hands on a wall. Lean your body forward. Bend your left knee and stretch your right leg behind. At this pose, make sure that your heels do not move. Hold for 10 seconds. Repeat the movements with the other leg. Having finished the movements, repeat this exercise 5 times. Heels lifting exercise. Hold on a stable object with both hands. Lift heels off the ground. Hold for 5 seconds and then return to the standing position. Repeat this exercise 20 times. Ankle stretching exercise. Sit upright with feet on the floor. Lift right leg at the horizontal level. Move right foot up and down 5 times. Repeat 5 times with left leg.
Ankle rotation exercise. The 5th series requires sitting down. Raise one leg, rotate your foot outward 10 times, then rotate your foot inward 10 times. Repeat the same movements 10 times each with the other leg.
Foot exercise. Prepare a towel and a chair before doing this exercise. After sitting on a chair, step on the towel. Then keep your toes flat while grasping the towel with the sole, and then relax. Perform the exercise 20 times with the other foot.
Remember, do not do the heels lifting exercise if you are already suffering from plantar fasciitis to avoid worsening the state of the illness and the pain at the foot.
Do not do the ankle rotation exercise, nor perform the movements of bending the knee joint if you are suffering from osteoarthritis of the knee, to avoid increasing the stress on the knee joint and worsening the inflammation.
Wow, it's quite simple.
You would better not do it half-heartedly because of the simplicity.
Hey, I can do as much as I can during rest.
You may easily overreach yourself by doing excessive exercises.
Of course I know that. Also, a balanced diet and adequate sleep can help you keep your foot free from disease and keep you away from illnesses. After the graduation holiday, I can only use the word refreshed to describe me now.
I can also use refresh to describe other persons.
Why do they seem to be more energetic than I am?
Sure. We all follow your ways of improvement and we all do lower limb exercises.
So now we're all so refreshed.
Yeah!